We are going to do a central line dressing. I have knocked on the door, I've introduced myself. I'm going to wash my hands and provide for privacy. I've explained to my patient that we are going to change his dressing on his central line. I will identify him. Can you tell me your name and your date of birth? And do you have any allergies, specifically to chlorhexidine or iodine? No? Okay. I've already lifted the bed up to a comfortable working height. My patient is part of my sterile field, so I want to make sure that he is high enough, at least belly button height, so that I'm not leaning over the field. I've also dropped the side rail so that I have easy access to my patient. I am going to review all my supplies, make sure I have everything that I need. I have my dressing change kit. You want to make sure that you know what is in your kit before you start this procedure. Some of them come with a tape measure, some of them don't. Some of them have sterile gloves in them and some of them don't. So you want to make sure that you have everything you need before you start. I also have clean gloves, a mask for myself, and my sized sterile gloves. We're going to expose my patient so I can see what we're working with and put my clean gloves on. I will put a mask on my patient and ask them to turn their head away from the site. Put this here. And then I will open my sterile dressing, or sterile kit. Making sure that nothing falls out, nothing touches the outside. Okay. And then I will put my own mask on. I'm going to measure this site before I take off the dressing. This keeps it a little bit cleaner so that you're not actually touching the site without a dressing. Make sure you're measuring in centimeters, not inches. Start from that insertion site and follow the catheter down. And you're measuring to right here where the actual catheter ends, not this tip. So this is 32 centimeters. With my clean gloves on, I will remove my patient's dressing, starting from the outside and working my way in. You can put your finger down here to stabilize the catheter while you pull it out, but don't put your fingers close to the catheter insertion site. And gather it up into a ball and pull it straight up. We'll then remove my clean gloves, wash my hands if I can, making sure that I'm not going over my sterile field. And then I'll put my sterile gloves on and set up my supplies. Okay. There is a sterile drape inside my kit that I can lay out and use to place all of my supplies. Remember not to touch the table now that you're sterile. This kit did have a measuring tape, but I don't need it since I've already measured. I have gauze. There's a barrier pouch there. We have a stabilization device. Our Tegaderm. And I'm laying everything out so that it's easy for me to reach. I have my tape. And then I have two options for cleaning the area, which I will show you both. I'll just put that right here for now. Okay. This one is ChloraPrep. If you have this in your kit, you'll go ahead and squeeze to pop that fluid into the sponge. And then you can either use your gauze, or if you have tweezers in your kit, you can use that to stabilize the catheter. And then with this, you want to vigorously clean back and forth, going all around the catheter site, making sure to hold this loose so that there's no chance that you're going to pull it out. Clean all around that site vigorously, and then clean the catheter gently, making sure not to pull it. And then you can put that down, and that goes in your trash. If you have these ChloraPrep swabs, you can open them and then using one at a time, there are 3 of them, you will do the same thing, back and forth vigorously. And throw those away. You can use each one in different sites. And the last one down the catheter. Any supplies that you've used on your patient, make sure not to put them back onto your sterile field. They go straight into the trash. You want to let that dry without waving it. Obviously you can't blow it because you have a mask, but you just let it dry naturally. If you have any bleeding, make sure to put some gauze under there. While it's drying, I am inspecting for any loose sutures, inflammation, infiltration. The site looks good, so once it is dry, we can put our dressing on. Your kit may contain a stat lock, something like this. Follow your hospital's policy to see if you need it, but you would put it underneath and then lock it into place. That helps to keep it in the right position. We're going to pull the back off of this Tegaderm. And with the insertion site right in the center of the Tegaderm, push it down. Push in the middle first, and then follow down the catheter. Pushing down until it's occlusive. Once it's on, you no longer need to be sterile. Pull off the top papers. And then you can use this to document your initials, the time and the date that you change this dressing. You can also use the tape that you have in your kit to tape this up so that you have easier access to it. Make sure not to put tape or your label right on top of your insertion site because you want to be able to see that so you can monitor it. As soon as you're done, make sure you're taking your patient's mask off. Take off your gloves. Document the procedure, including the length of the catheter, how the site looked, if there was any bleeding, and when you change the catheter. Clean your hands, drop your table and your bed, and make sure your patient doesn't need anything.